So we're going to review the function and setup of a CADD PCEA pump. So we're going to begin by turning the pump on by using the on button on the side. We'll press that and then we'll give it a few minutes to start up. It's going to ask if we want to start a new patient. We do, so we're going to say yes. Then let's take a moment to review some of the different settings that we use in the surgical division. So we use primarily 3 different settings. Number 1, epidural. Number 4, paravertebral nerve block, and number 5, peripheral nerve block. In this case, let's go ahead and set up an epidural. So we're going to hit select. It's going to ask if we have a continuous dose or a continuous with a PCEA dose. So please check your MAR and ensure that it reflects what we're programming. All right, and now we're going to select the medication. So we're going to use hydromorphone with bupivacaine, and we'll hit select. Now the code is 310, so we're going to enter that code by using the arrow buttons. Once you've reached the desired number, you're going to hit select. Okay, so now you'll see therapy option number 1, epidural. Please note that this 1 has nothing to do with a dose or a rate. It is only the option number. So once you've confirmed that these are all correct, we're going to hit yes. Now it's going to ask us to review the pump settings. What it's really asking us to do at this point in time is to program the pump. So to do that, we're going to hit review, and then we're going to change these values as needed to match our order. So let's say that we have a continuous rate of 6. We're going to arrow up until we get to the desired amount, and then we're going to say save. From there, we're going to check our PCEA dose. So let's say that we want to change that to 4. We're going to again use the arrow up button to reach our desired value and save. Now for PCA lockout, again, check your MAR. It will often be 10 minutes or 15 minutes. Please make sure that your max doses per hour reflect your PCA lockout. So for example, an every 10-minute lockout means that the patient would get a max of 6 doses in an hour. So we're going to go ahead and hit select, and we're going to scroll up to 6 and save. Now we're going to go down one more time to the reservoir volume. So please keep in mind that these bags come from pharmacy and it could take 2 to 3 hours to make a new bag. So for that reason, I recommend that you program significantly less volume than what you have to ensure that you have adequate time to request a new bag before it goes dry. So in this case, we're going to take that reservoir volume down to 220. And save. Now it's going to ask us to confirm each of these values. So we're going to check these with our MAR one more time, and as we're doing that, we're going to put a little check mark next to each one of them to accept that value. And then we're going to go to next. So now it tells us that our cassette is not attached. So we're going to be using our PCEA tubing. This contains 6 mLs. And now we have our cassette here. So please note that this cassette has these 2 little teeth right here. And those correspond with 2 little holes down here. So what we're going to do is we're going to go in at an angle so that we can get this inside here. As you notice, this doesn't fit in on its own. So in order to allow it to fit, we need to pull this lever down while simultaneously pushing up on the cassette and then return the lever to its original position. It's now going to ask us if we want to prime tubing. You always want to prime tubing with a pump. There is no way to prime by gravity or manually. So we're going to go ahead and say yes to prime tubing. It's going to remind us to make sure we're not connected to our patient. Obviously, we don't want to infuse air into our patient, so we're going to make sure we're disconnected as we are, and I'm going to go ahead and hit prime. Now in the real scenario, you're going to need to prime with at least 6 mLs in order to fully utilize and exit any air from that tubing that's being used. For the sake of time for this video, we're going to go ahead and say stop priming now. It'll ask us if we want to continue priming. We do not, so we're going to say no. Now it's going to tell us that the cassette is not locked. So what it's asking you to do at this time is actually to lock the cassette right here. You will lock the box later, but right now it's asking you to lock the cassette. So we're going to go ahead and place the key in, and now we're going to say start pump, yes, and the pump is running.